Hello, my name is Petra Neely. I'm an evaluator in the Department of Health and Human Services, Office of Inspector General. Our mission is to protect the integrity of HHS programs and the health and welfare of the beneficiaries served by these programs. OIG is committed to working with IHS to strengthen patient care in IHS and tribal facilities. Through our studies, we identify specific opportunities for improvement by IHS. OIG and IHS have partnered to improve healthcare quality and patient safety. In this video, I will share OIG findings about and recommendations for IHS regarding patient protection policies from a recent two-part study, both of which are linked below in the resources section. The first part is Indian Health Service has strengthened patient protection policies but must fully integrate them into practice and organizational culture. And the second part of the study is Indian Health Service facilities made progress incorporating patient protection policies, but challenges remain. I will also share OIG findings from our audit work related to tribal health programs' compliance with federal requirements to perform FBI fingerprint background checks on individuals working with children. These reports are also linked below. We're including this information in this training so you will know the key steps IHS has and is taking to protect patients and the areas in which you would likely see further development of additional IHS guidance. First, some context specific to IHS. As you know, IHS partners with 574 federally recognized tribes to provide health services to its 2.6 million American Indian and Alaska Native beneficiaries. Collectively, IHS and tribes operates 170 service units, including hospitals, health centers, and other types of facilities. The vast majority of IHS providers are deeply committed to providing safe care for IHS patients and their families. But over the years, there have been a number of allegations of patient abuse committed by IHS employees, some of which have involved minors. For example, in September 2018, Stanley Patrick Weber, a former IHS pediatrician, was found guilty and sentenced to prison for sexually abusing patients under his care while he was working at an IHS hospital in Montana between 1992 and 1995. In September 2019, he was also found guilty of sexually abusing minors while working at an IHS hospital in South Dakota from 1995 to 2016. This case created a reckoning within IHS and HHS more broadly. How could this happen for decades to children at federal facilities, and how can we prevent this from ever happening again? IHS needed clear structures to ensure that a small number of criminal actions would have no place in IHS facilities. So as part of its efforts to address and prevent patient abuse, in February 2019, IHS issued new policies to protect children from sexual abuse by healthcare providers. And you can learn more about the patient protection policies found in Part 3, Chapter 20 in the Indian Health Manual in our related video, IHS Commitment and Policies. You can also refer to our other companion video, Reporting Abuse, Understanding Investigations, and Coordinating with Law Enforcement, for more information about the Dr. Weber case, how to report suspected abuse, and what happens after a report is made. Now on to the studies introduced earlier. OIG examined the sufficiency and implementation of IHS patient protection policies in a two-part study. Part 1 inventoried and assessed agency-wide policies and procedures, with particular focus on the new policies, and compared them to 3 nationally recognized professional healthcare organizations. Part 2 evaluated implementation of the new policies at the facility level and identified challenges to their effectiveness. So let's talk first about protecting patients through policies. In the first part of the study, we found that IHS had strengthened its policies to protect children from sexual abuse by providers, and that the policies, linked below, were largely consistent with those of the benchmark organizations. Specifically, we found that the policies included provisions on provider-patient boundaries, medical examination precautions, mandatory reporting responsibilities, and protections for patients and staff. IHS has long-standing policies on ethical and professional conduct of healthcare providers that prohibits providers from engaging in romantic and sexual relationships with patients. The new policy provisions include further directions for limiting communication between providers and patients outside of the professional setting, and emphasize IHS's zero tolerance policy for the misuse of a healthcare provider's authority. IHS policies also include precautionary measures for medical examinations, including guidelines for providing chaperones during medical exams and obtaining patient consent. Obtaining patient consent and preparing patients for a medical exam or procedure, particularly one that involves the genital area, is important so the patients know what to expect and therefore can better recognize if they are being sexually violated. The new policies also include detailed guidelines for reporting patient abuse. All staff are required to report within 24 hours any incident or reasonable suspicion of sexual abuse of a child by a healthcare provider directly to the appropriate child protective services and or law enforcement authorities, as well as the OIG hotline. Staff must also report to their supervisor or facility CEO and to the IHS hotline within 1 day and document the report in the IHS incident reporting system within 5 business days. And you'll learn more about these reporting mechanisms in our companion videos. IHS policies include provisions for ensuring confidentiality and protecting patients and staff involved in or affected by patient abuse allegations. This includes provisions for removing a suspected provider from patient care and prohibiting any form of retaliation or coercion of staff who report abuse. Although IHS has strengthened its policies, we found gaps in their coverage. The policies are specific to sexual abuse of children perpetrated by healthcare providers employed by or under contract with IHS. They do not explicitly address other types of abuse, adult victims or perpetrators who work in IHS facilities but are not healthcare providers. In response to an OIG recommendation to expand policy coverage, IHS reported that it has plans to update its policies to include more types of potential perpetrators and broader prevention of patient abuse. During our second part of the study, we found that most facilities individually expanded their local patient protection policies to include more types of abuse victims and or perpetrators. Next, let's talk about mandatory training. In June 2019, a few months after IHS issued the new patient protection policies, it launched an agency-wide mandatory training on the policy content and related reporting requirements. The training, which all IHS employees and contractors are required to complete, includes information on indicators of abuse, organizational safeguards for ensuring patient safety, and reporting guidelines. The training is linked below, and you can learn more about it in our companion video, IHS Commitment and Policies. This is an area where each of you can make a difference. Take advantage of all the trainings available to you. Now I'll tell you what we found regarding implementation of these policies. During the first part of our study in 2019, we found that some IHS facilities were still in the early stages of revising their local policies to align with the new agency-wide policies. A year later, during the second part of the study, we expanded our review to assess facility implementation and identify potential challenges to policy effectiveness. We found that all facilities were in the process of incorporating or had fully incorporated the new policy content. However, nearly 2/3 of facilities reported encountering or anticipated encountering challenges to carrying out the new policies in practice. The most common challenges related to providing chaperones during medical exams, ensuring anonymity of victims and reporters, coordinating with law enforcement, and understanding policy content and coverage. In response to OIG's recommendations related to these challenges, IHS described plans to conduct compliance reviews and provide additional training. During our review, we also found that barriers exist that may deter staff and patients from reporting abuse. The most common barriers related to personal relationships between the potential reporter and the alleged abuser. Fear of identity being revealed, sensitivities and stigmas related to abuse, and confusion over what and how to report. However, we also found that administrators across IHS facilities were largely confident that staff would report abuse. In response to OIG's recommendations related to reducing barriers, IHS described improvements to its new incident reporting system and its oversight processes. OIG also recommended that IHS conduct additional outreach to tribal communities regarding patient rights to help address these barriers. And during the second part of our study, many facilities reported that they had done some community outreach. For more information on barriers and reporting, see our companion video, Reporting Abuse, Understanding Investigations, and Coordinating with Law Enforcement. Background investigations are another important step in protecting patients. Federal law requires IHS, along with tribes and tribal organizations that contract or compact with IHS, to investigate the character of each employee, contractor, and volunteer who has contact with or control over Indian children. Among other checks, the character investigation must include a fingerprint-based criminal history background check through FBI's Criminal Justice Information Services Division. Character investigations also include state and tribal criminal history and references checks. In prior OIG audits of 2 tribal health programs, we found that the programs did not always perform required FBI fingerprint background checks on individuals working with Indian children. In August 2020, OIG issued an early alert to IHS regarding similar findings during an ongoing audit of other tribal health programs. In response to the early alert, IHS issued a Dear Tribal Leaders letter instructing IHS area directors to initiate meetings with all contracting and compacting tribes and tribal organizations to inform them of their requirements to conduct FBI fingerprint background checks. The audits, early alert, and Dear Tribal Leader letter are linked below in the resources section. In summary, OIG's work has found a number of areas for further improving IHS policies, processes, and trainings, and strengthening the agency's ability to prevent patient abuse. Thank you for taking the time to learn about OIG's work. Our commitment to monitor and improve the care and protections of patients at IHS and tribal facilities continues.